of the abdominal muscles and development for firmer abdominal. So CoolTone is also cleared for strengthening, toning, and firming in the buttocks and thighs. CoolTone uses electromagnetic muscle stimulation, which is referred to as MMS, and that's to strengthen, tone, and firm the muscles. CoolTone has 50% more intensity than any of the leading competitors at the point of patient contact. Another great thing about CoolTone is it has a liquid-cooled applicator. So we're gonna, we have Lauren here, who is our specialist, our CoolTone specialist, and we're gonna actually see her doing a treatment today on Katya, so we're really excited to be able to show you that today.
Hi everyone, today we are actually going to be setting her up and doing the treatment, and this is her very first treatment. So I will go ahead and show everyone how I have her set up. So I have my paddle, and I've already found my exact positioning for her. I will pull this over to get her secured. Katya works out on a regular basis. She's in pretty good shape. So she's just looking to get a little bit more definition for the summer. Any other questions before we get started?
Am I going to be sore after?
So you probably won't be sore after. So a majority of our patients have found that their abdomen just feels stronger afterwards. Maybe a little bit fatigued for the muscle, but just a little bit stronger. But otherwise not sore. It's not like you've done those, 50 crunches at the gym. Are you all set?
Yes.
Okay. So you'll hear a fan start and then a series of taps and vibrations. And this will go for 30 minutes. Do you feel anything yet? No. Okay. So with this treatment, I can actually adjust the intensity of what you feel. If anything feels too much, you let me know. If you don't feel much at all, also let me know. Okay, so I'm going to go ahead and just feel a little bit. Okay, so I'm going to let your muscles start to warm up for the first 5 minutes. You're about 30 seconds in already.
So it's kind of the same as when you're working out. You have that beginning period where you're warming up the muscles.
Correct. Yes, warming up the muscles, and what's great is you're able to lay there and relax. So we ask that a lot of patients don't wear any electrical devices, watches, and we ask that patients do not use their cell phones during treatment. We ask this because we have electromagnetic fields going on right now, so we don't want that to affect our health. So contraindications for a treatment like this is metal implants. So no pacemakers, metal implants, pacemakers, and just, for women, there's certain contraceptives that are not allowed during this treatment, like IUDs, like a copper IUD. Yeah, a lot of us wouldn't think of that, but it's great to know. What are you feeling right now?
Drums.
Like drums, yeah. Like, it's pretty interesting, right? But it doesn't hurt. No. Go back to my machine and put you out a little bit more. And our goal during this treatment is not to get you to the highest setting every single time. It's just to get you to that point where you can feel that contraction.
Tell us how you feel.
They telling me
On the scale level of 1 to 10, as far as being uncomfortable.
it's not uncomfortable.
Do you want to talk a little bit about the protocol, how many the initial treatments are,
So initially what we do is we have patients come in for their first 4 treatments within 2.5 weeks, every 48 to 72 hours. So it's a little bit of a commitment within those first 2.5 weeks, and then after that you come back once a month for your treatments. month for how long? We say you can do 4 treatments or 6 treatments, both of those treatments.
And what areas? What other areas?
So the other areas that are able to be treated are the abdomen, the front of the thighs, and the buttocks. Those are what's FDA approved currently.
There was a question on the timing between the treatments, the initial treatments, the 4 to 6 initial treatments.
Okay, that's every 24 to 48 hours we get to see our patients. For the first 2 weeks.
Okay.
And then you wait 30 days post your 4th treatment, and then we start the maintenance program.
Correct.
And then we'll do a series of 8. So every month and a half, to maintain those results, those initial results.
For the people that are online right now, if you have any questions, just go down to the bottom area where it's chat and go ahead and send in the questions, and we'll make sure that they'll get answered on this call, or Lisa or Lauren will give you a call back after the video.
I don't know if any patients can see that are watching him, but you can actually at this point see her abdomen jumping a little bit. And she said it tickles. That's actually not a bad thing. So you can see those muscles contract.
So is this the point where you would consider being at like the intensive workout phase?
Yes, this is
So
exactly where we want her
Okay,
to
so
be.
we finished the initial warm-up, I've been doing the workout, and now we're delivering all of that energy to those muscles to really get that contraction. So with that being said, Katya, say a scale of 1 to 5, 5 being the most intense, where do you think you are in comfort level?
Like, I feel the contraction of the muscles.
Okay. But it's very tolerable.
Yeah.
Okay.
So what's the highest I can get?
You can actually get all the way to 100%. Right now, I have you at 90%. So you're definitely tolerating this very well. Some people, they may have a different pain tolerance, or some, might be nervous. So we can just, kind of get you up as gradually as possible and get those muscles contracted.
So can you do 100 every section?
Every time if you'd like, you could. Yeah, if that's where your muscles can tolerate. What I've noticed with some patients, the longer we go with their treatments, the more contractions they get at lower percentages. That's just what I've noticed during treatment. Since you're tolerating well.
Okay, so we have another question here. Is this treatment mainly for people that are fit and want definition, or could it be for those who need to burn fat? Great question, Christine.
Great question. So a lot of patients have also noticed a strengthening in the area. So not only abdomen and the buttocks and the legs, but they've noticed the strengthening. So it's not just for definition. Another thing that you can do for losing fat is adding CoolTone along with this treatment. So a normal protocol for that would be doing your CoolTone treatment first to debulk the fat. Or I'm sorry, CoolSculpting for that, and then adding the CoolTone on after that.
Just keep in mind, the CoolTone is working on muscle. So what makes it so unique is that it's bypassing the sensory nerves, the fat, and the skin, and working directly on the muscle. So we want to make sure that if we need to address the active tissue, if there is fat, we reduce it with the CoolSculpting first, and then go into the CoolTone.
Tongue twister.
I know.
So another question, what happens if I get my 4 to 6 initial treatments and then I stop?
So with that, we do recommend doing the add-on treatments every 4 weeks. If you do end up stop doing the treatment, we do notice that the muscle starts to atrophy. So it's good to keep up with those.
It's just like doing Botox.
Yeah, Botox of the body pretty much coming into the maintenance. The tickling.
So we have some new people that have joined. If there are any questions, please let us know. We're going to continue on with the treatment, and then I have a couple other questions that I'm also going to read out. But how are you doing, Tatiana?
I'm doing good.
Yeah.
And the good thing, I mean, it's very quick. So we're, other than the initial treatment, it's a little bit longer because we'll be taking photos.
Mm-hmm.
You should be in and out in, what would you say?
30 minutes, 30 to 35 minutes. So the first treatment and the fourth treatment, we have our patients change into these wonderful shorts. So everybody has a great baseline for their photos. After that, everyone can actually just come in their workout clothes. They come in in stretchier clothes, thinner clothes. You just jump on the bed, we hook you up, and then once the treatment's done, you're good to go. You're free to go about your day. You can go back and exercise, you can go to the grocery store, and do whatever you need to do.
So we have a question. If a patient has CoolSculpting or sculpture to remove the fat, because this is not removing the fat, how soon can they then go on and start doing CoolTone?
Well, my understanding, I think the best approach would be to let them get to their final results so we know what we're working with. So if you're doing CoolSculpting, your final result will be at 90 days, so 3 months. We'll wait for your final result and then start the protocol for CoolTone. Sculpture is 12 weeks to get your final result.
Okay, so 3 months, 12 weeks before, after they're done with the
Right.
CoolSculpting.
In the event that we need to do another treatment of CoolSculpting, we want to address that first before we address the muscle.
Thank you.
Doing good?
At the end, do you have any questions? Hanging in there, you're holding on.
Yeah, a lot of my patients actually nap during the treatment. Their time to kind of relax. You know, it's not like the workout where you're sweating and you're concentrating. You know, you're able just to kind of relax and it's nice.
Okay, I'm going to give another question here. So coming in, if a patient goes to the gym, what more can CoolTone do for them?
Yes. That's a good question, actually, because a lot of people ask that question. So what happens is our brain learns to utilize our muscle fibers when we work out.
Mhm.
And besides elite athletes, most people use about 35 to 45% of their muscle fibers. So the brain realizes that we do not need to use 100% of muscle fibers, so we don't. The only other scenario would be a pure adrenaline driving us to trigger all muscle fibers. So what's being said here is that we're engaging all muscle fibers that typically would not be engaged in a workout that you would do in a gym, right? Those little fibers that we're not targeting. So this is targeting the entire area, and the technology allows us to utilize the muscle fibers, which will give you a better result visually and functionally.
Thank you.
So we were saying that before with another patient about the ideal patient. So if you're not looking to have that six pack, you can get the results of strength in that down the wall, which is very fun.
Right. And some of us ladies who are post baby notice that we cannot engage our abdomen as well.
Right.
So I've noticed for myself that after these treatments and continuing with these treatments, I'm actually able to hold my tummy in, where after a baby, you're not used to that anymore. So this is actually helping with strengthening my muscles.
I have a question. What is your best patient, that would do very, very well with CoolTone? What is a patient that you probably wouldn't recommend CoolTone for?
I think Poppy is a really good patient. Yeah. We also what she did like before we the applicator.
I agree. And then I think too, even if there's patients that are looking for the fat reduction, we have options for them too. We have the CoolSculpting and the sculpture. So we have options for everyone.
Right.
Doing good?
What percentage is she at?
100%.
So we're going to be going for about 5 more minutes here. So now's your chance to ask any questions. While we're waiting for some questions, Lisa, talk a little bit about the program, how it works, the cost, promotions, or anything like that.
All right, so as Lauren said, our initial protocol is 4 to 6 treatments, and we're going to do those 48 hours apart from
48
each
to
other,
72 hours.
right? In about 2.5-week time frame. When we finish the 4 treatments, we're going to go into a maintenance program 30 days post that 4th or 6th treatment. And we have a package going today, just to get that price that we have today, so the package of 12, which includes that startup initial program, and then your maintenance program, which will take you through the year. So this price is gonna help you, or it'll help you maintain those results for that entire year. So the regular pricing is $3,600 for the package of 12. And today the pricing for our event is $3,000, so you're saving $600. Not only that, when you do the package, it'll lock you into the price of $250 per treatment for maintenance, and that's a lifetime price. That price is going to increase because this is our promotional pricing. And we also have a raffle today. So whoever purchases today, your name will be going to a raffle, and the winner will win 4 free CoolTone treatments, which is a savings of $1,200.
Do you think that this is something that you expected? Did you expect it to hurt? What did you expect coming into this?
So I didn't know what to expect.
Yeah.
This is my first time knowing about this, but it feels like a massage. It's not painful at all.
Awesome.
It actually made me laugh a little bit earlier. I'm not used to putting pressure in my eyes.
Yeah.
And she's at 100%, so
Yeah.
it's just something you feel like a massage.
Exactly.
Is there anything more that you would want to tell those attending that they would maybe go off of before the treatment or not take any?
No, there's no other contraindications as far as medications. The only thing I would say is maybe just not a big meal before coming in because it's contracting your abs. But otherwise, pretty.
I can go in the sun too.
You can, if you'd like, yeah, you can. What's nice is there's no heat being delivered into the skin, so topically there's nothing that will prevent you from going back to your normal activities.
Okay, we've got another question coming in. Can I get the information texted to me? It's hard to hear the program prices. So yes, I'll go ahead and make sure that all of you get an email with the pricing and information and the promotion. So got that, Rosemary.
Oh, okay, I'm so sorry. Rick pointed out to me that I misquote on the normal pricing, so the savings is so much better than I first said, so I do apologize. The normal pricing is, rather than 300 treatments, actually 500 treatments, so that's a huge savings today. And again, that then locks you into that lifetime price of $250 a treatment, which is half the amount going forward after your 12 package, your startup and your maintenance. It's a huge savings. Thank you.
You're
Greg.
welcome. I just thought I would.
No, that's huge.
Yes.
So does the machine stop? Like
Yeah,
when
so it does. So it goes for 30 minutes. So there's different protocol for different parts of the body. So as soon as the 30 minutes is over, the machine stops and then we unhook you. So easy for everyone on both ends.
Can you talk one more time? She had mentioned about the different areas of the body
Yes.
that CoolTone could be used on.
Yes. So the different areas of the body that are FDA approved by Allergan that we can actually address are the abdomen, the buttocks, and the upper thighs. So we do have 2 paddles. There's actually another paddle on this other side of the machine. So Katya is pretty petite, so I can only fit 1 paddle on her. But somebody else who has a larger frame, I have 2 paddles I can actually put on their abdomen. And then obviously 2 paddles on the buttocks and then 2 on the upper thigh. So it can be treated at the same, both legs are both sides of the buttocks can be treated at the same time.
So you can get your stomach done with 2 or your butt on 2, but not your stomach and butt at once.
No,
Okay.
no, we can't really split that up because we definitely need to be treating that whole area at once for that contraction of the muscle. And we don't want to be lopsided with one side up and one side down. What's great too, other areas that with the buttocks especially, is not only do we want to stimulate the muscle, a lot of women see a nice little lift. So a lot of us women get something they call the banana roll. So we have like a little roll of fat underneath our bottom. So what it does is it works the muscle so that it actually can give you a little bit of a lift. So it's great for bikini season.
Megan, do you have any of the buttocks and the before and after pictures?
Yes, in fact, I'm going to go in right now, and thank you for that. I'm going to go ahead and show you some before and after pictures. So hopefully everybody can see this here.
So as you can see, this is 10 days after 4 treatments of CoolTone. This is the abdomen. This patient obviously works out on a regular basis, and she wanted a little bit more tone. But as you can tell too, her stomach is a bit more contracted inward, so she's able to engage that abdomen a lot better.
Very nice. That's a really nice definition that you're saying. And that's also after the 4th treatment.
Yes. This one's immediately post 4th CoolTone treatment.
So we wait 30 days and then we start the maintenance program.
Correct. This is another abdomen that you're seeing. This patient's able to engage her abdomen a bit more, and you can see it's a lot more definition on that upper part of the abdomen. This is another great example as to how we can get the definition on those packs of abs.
Right. So that's somebody obviously that works out and is fit, but they're now getting the definition they've probably been trying to get for years at the gym that just aren't able to accomplish it.
Correct.
Oh wow, that's impressive. Again, really defined abdominal muscles there. This is probably someone that works out a lot and just hasn't been able to engage that upper abs and get the definition that he's been looking for, and that's a great result. And the great thing about maintaining is, you know, you don't have to go to the gym every day now. Once you get to that point where you want to be at, we can keep you there for the following year, coming in every month, a month and a half.
So this does go through a different series of tapping and contracting. Right now she's going through a tapping series. And the reason that happens is we want to keep those muscles gapping. It just feels like a little bit of a drum in between all of those muscle contractions.
So how much time has gone by of the total treatment?
So she has almost 8 minutes left. So she's doing great.
Any other questions?
So we're going to sign off in a minute or so here. So if there's any other questions, now is the time to answer.
And again, if you purchase today, we'll put your name in the raffle. So that's 4 free treatments.
Okay, well, I think that is it. Thank you, everybody, so much for coming on and being a part of this. And I said, this will also be on the website in a little while. So, thanks, everybody. Bye-bye.